Welcome back to the Performance Prescription. I am here with Christine Albert. Christina, we've known each other for a few years. I'd love for our audience to get to know a bit better. A lot of our listeners and viewers are friends and colleagues of yours, and others are just getting to know you for the first time. So, what would you give us a brief little introduction?
Yeah, thanks. It's great to be back talking again with you, Jared. Looking forward to this conversation. Well, I am I'd like to joke, a recovering CMO, CXO from a healthcare system. I've spent much of my career in hospitals and systems, about 20 years, in a variety of roles, mostly focused on brand strategy, digital revenue and growth. And then in my last role as Chief Experience Officer, leading people and operations, as well as that brand and marketing side of things. So currently, I work as an advisor and a consultant, primarily in healthcare, working with systems and hospitals just around that. How do you lead through transformation and growth? How do you navigate that uncertainty? And how do you do that all with applying really a experiential lens to the work you're doing?
Yeah, let's dive into that, and let's maybe set up our conversation today with the frame of what healthcare growth actually looks like today, and we'll build in that experiential framework to that if that works. I think it's the position of target continuum. Safe to say that growth is much more than acquisition, but that's a big part of it. So for growth to be sustainable, you have to talk about all the things that lead up to a patient scheduling an appointment and during and after, not just that actual experience of them choosing a time and then actually showing up for the appointment. There's so much that goes on before and during and after that. To that end, it makes sense to have this conversation structured around the idea of growth being bigger than just acquisition. What's been your experience there, and how is it useful to frame that up for marketing leaders today?
Yeah, no, that's a great question. There's a lot to dig into there, so I know we're going to have a lot of fun with this. But just as you said, too, lots of organizations, especially when you're speaking to marketing professionals and digital folks, typically they're the ones who are tasked with what we would call kind of more those performance marketing goals. So our service line goal is to grow by X percent or X appointments this year. We're looking to grow our market share by X percent. And oftentimes it's the marketing and digital and communications teams who are tasked with okay, make it happen. So what's so interesting to me is that growth, typically that conversation happens around net new acquisitions. We need new patients, we need to grow. But as we know too, not every market is one that actually has population growth. You may be in a rural area, you may be in a market that isn't growing at all, or you might be really lucky and be in like in Atlanta or, a Dallas that's really growing exponentially. But, really thinking more about the goal is to hopefully grow your service or grow your reach of patients, but oftentimes the gap or the hiding in plain sight secret is that you can accomplish that oftentimes through retention and progression of your existing patients who already know you, who've already hopefully had a good experience with you and have some degree of trust. So I like to reframe that growth conversation less about go out, acquire, and try and find new, which is hard and difficult and expensive, takes a while, and really turning that kind of diagnostic lens to the organization you're working with or the practice you're working with today to understand, for example, if our goal is to grow primary care practices and services by a certain percentage, just looking to see of our existing patients, of those panels, what percentage of them are coming every year just for their annual exams? Something we want them to do from a population health perspective, but also it's predictable scheduled revenue and volume. So we can see that coming. And then maybe even look 2 years back to say in a 2-year runway, kind of an active patient, how many are coming? And oftentimes asking those kinds of questions just to understand what's happening with your existing patients can reveal things like, 60% of your existing primary care patients don't come for their annual wellness exam. Well, that's an aha moment of, well, what can we do in design to reach those people first? It's the right thing to do. They're already in the system. It supports that total health and wellness goals. Oftentimes it's free, especially if you're talking about a Medicare audience, so it's no cost to them. So really then that conversation becomes about reactivating, retaining, and then ultimately progressing to other service lines.
Yeah, I think of this as different aspects that we kind of add in, and target continuum refers to it as unifying patient acquisition. They talk about five lenses that you look through, and one of those is access. That's definitely part of this. I don't think you'd find a healthcare marketing leader who would disagree that access is part of it, but I still don't know that we're always necessarily making that connection of like access is part of the experience that leads to satisfaction with an attempt maybe one time to schedule an appointment that there wasn't availability. That's going to affect the next time that somebody schedules an appointment. So how do you see access playing into a growth strategy, and what are most common ways that health system marketing leaders can just pay attention to it a little bit more?
Yeah, I love that question around access because sometimes you also have kind of siloed thinking where you're like, well, my job is to develop the retention acquisition campaign, digital campaign, CRM, and go and find. And access or billing, that is someone else in a different department. And so I think what's imperative is just to bring this like consultative thinking. So, regardless of your job title, your role is to show up and just look at that total patient experience, like you said, too, from picking up the phone or trying to schedule online, or even what is that experience using if you have an AI integration in some of your call centers, which we're seeing a lot now, which is to actually walk in that patient's shoes and to go through that experience and to map it based on all the ways they can access you, even through my chart, just to understand what does it take? What's the friction? How easy or difficult is this for me to make that appointment? And just to understand that before you worry about anything else. And you may not be able to change it. It may not be something you own, but it's definitely something you can elevate and share. For example, you can say, we do have online scheduling and we are promoting that. However, the first available appointment is in 3.5 months. And the scheduling took 15 clicks to figure that out and 10 minutes. This is not a great experience, and we can see people leaving and not converting. So, just to understand and to elevate that to operations, to practices, to others. Oftentimes, when you sit in an organization, that's just kind of wallpaper. It's your everyday. So, you're not thinking like that outside in perspective. So, I think professionals, no matter where they sit, can bring that outside in thinking, and then you can design around it and say, well, since we know this, here's how we would adjust, or here's what we'd recommend doing or not doing. But for that patient or consumer, everything you do is a reflection of how much they can trust you. So access and scheduling seems like it shouldn't be insignificant, or it should be, it's not clinical care. But if it's so hard for me to even get in, or it's so confusing, just this piece, what does that actually mean about me being a patient navigating when I really need care? Is it going to be so hard?
Yeah, and to be clear, you're talking about like experience design. How much is that a part of marketing today from organizations you've worked with or familiar with? Is it like do we still have some room to grow there ourselves in terms of understanding how different pieces relate to it? You mentioned trust, for instance. In my mind, experience is built on trust. It either leads to trust or lack of trust in an institution. So it plays a part in things that the marketing does try and spend a lot of time and money and invest in to build up their trust. And then you have something like an individual's experience that either adds to that or validates that trust or detracts from it. You have either more or less trust because of that. I guess just tell me how experience design comes into play now as we are talking about some of these growth strategies.
Mhm. Yeah, no, I think the experience is what makes your trust real. Like that's what your brand promise is. That's who you say you are as an organization to your patients and community. And so when they show up, that lived experience is either you fulfilling or maybe falling short of what you say you are. And so what's interesting to me is that there's a lot of discussion around this. Sometimes experience is one of those things that everyone talks about, but nobody exactly owns, and it just kind of sits in a little bit of an amorphous space. Something more concrete like patient experience and surveys tends to be more defined. But I think what we're talking about here is a more broad reaching experience. And so, again, it doesn't have to be part of your title or department or anything, you can still bring your design thinking, which starts with that, user-centered design, which starts with curiosity and asking questions, and then designing around that. And I think the advantage that, marketing professionals and strategy folks have is that we're really good at asking good questions and using data and mapping things and seeking to understand and then solutioning around it, to build some ease and clarity. And a lot of the touch points that we can influence are typically more top of funnel. And so often those are a little bit easier to manage, to massage, or to design around. If you're just seeking to find an urgent care center or to find a provider, you have a lot more flexibility there in what you can do and deploy versus, you know, um, specialty care where you need all kinds of specialized referrals for surgeons. So I think the space in which we operate around kind of those top of funnel conversions allows the flexibility to test and learn. And you can try and deploy lots of different things and see what works. And it's pretty low risk and low cost. So you can ideate quickly.
I love it. Yeah, it is. It's a big part of where marketing strategies are today. And thankfully, I would say a lot more leaders are familiar with at least some of the process of what you just described, the experience design uh, process and frameworks that didn't used to be historically part of marketing strategies at all. The other side of that is, okay, how do we execute it? How do we make it happen? That's the operational realities involved with that. And we all, especially anyone who has worked for a hospital or health system, who's worked provider side, understands this and has probably lived it day to day, has been in the trenches and understands the need to have processes, to have alignment with people, to have shared goals between teams, especially with those who are making it happen. It's never just the marketing team. It's usually IT. It's usually clinical leadership. There are so many other facets of an organizational structure that are required to be aligned enough. I don't know if they'll ever be all aligned. Is kind of me opining here. I don't know if you'll always have full alignment, but you need to be aligned enough to affect the ROI. How does that operational reality shape the performance of
Mm,
what marketing can actually do?
yeah. No, I think that's like where rubber hits the road ultimately. And it's moving towards more of an integrated approach. And it's easy to say, and it's super hard to do. Like you mentioned, it's how do you reach out across the aisles so that you're working with call center, you're working with IT, you're working with employed practices or service lines. And so it isn't just, hey, I need this, go out and find more for me. It's how are we looking at, what's the operational reality today in the clinic? Like, are your goals based on something besides just what you put on a piece of paper? Is it based on realistic goals, based on capacity, providers? What we have today. And so bringing that, just even having the conversation. So you're showing up not just as the person who talks about campaigns. That's not the job here. The job is to show up, again, in that consultative mindset where you're trying to figure out and understand what happens and how they do their work, how your work connects, and then what the through line is ultimately to revenue, retention, and growth. And so I think it's just initiating and having those conversations, but being super mindful of how you show up at the table and the things you're talking about. So you're kind of setting the menu with what you're talking about. Again, we're getting out of the campaign and look at my creative, not talking about that. We're talking about what is the business opportunity we're hoping to solve, and then what are the ways that we can influence or change that? And what are you willing to do operations and what is possible for us to do?
Yeah, are there any examples that come to mind or just like entry points, I guess, for that? Because there's so much involved with operations and there are so many different teams that do have to be aligned enough. Are there any places that you've just seen success come more naturally as you put more emphasis there?
Mhm. Yeah, I think it depends. Sometimes it's, shot selection too based on your organization. So I don't want to underestimate the power of maybe crisis or urgency oftentimes creates flexibility or willingness to try new things. So sometimes that organizational inertia is kind of hard to overcome. So if there is a mandate or a service line or a new provider, it can be something that isn't really a crisis, but there's a sense of urgency of Dr. Johnson just arrived and he's incredible, but he does not have a book of business, and we need to introduce this person, and it needs to be done, you know, now, yesterday. Then all of a sudden, you have the attention of providers, your operational partners and others, and they're kind of all united around this kind of urgent priority. So I'd say like look out for those urgent or crisis things because that's the place you can play and show up and really lead and manage um, and drive the change. And so that's kind of the high level version of that. But I'd say maybe an example of even small things that make a big difference when you do them at scale. An example might be looking at provider search and provider profiles on your website. Since we know it's a gateway, those get scraped. That's what people are looking for and finding. Um, and I've worked in an organization where it was kind of the standard white coat headshot, same, education, kind of all the table stakes things and we had a theory that based on brand and consumer research we had read, people were looking for that human connection and what they considered the best provider actually didn't have anything to do with diplomas or their degrees. It had to do with, can I talk to you? Do you hear me? Do I have a connection with you? Because I already expect you to be well educated and have all these degrees. Like, that's not setting you apart from anyone else. I expect it. And so we were able to convince a practice that was new and really wanted some additional volume and launching, would they pilot some different profiles? And so they were human, they weren't in white coats, they were infused with brand, and that provider was sharing a story about themselves, a hobby. It was warm, personal, and fun and memorable and had nothing to do with med school. And what we found is that generated about 30% more organic clicks and another 15% conversion to appointment, spending no money, spending no campaign money, just thinking differently about your existing work. But it took the practice and the providers a lot to let go of the white coat, standard traditional photo and profile. But when we did that, they were blown away by the success and the extra eyeballs and those appointments. And so then it became something that we could scale in the organization. And it just changed how we approached our business as usual provider strategy, but it delivered real business results.
I love it. It's a great example. And that's kind of related to my last topic here for you. And partially it's not last because it's the least important. It's probably the most relevant topic or most talked about right now because I wanted to see how long we could get in the conversation before I asked you about AI. So
I know. We made it pretty far.
pretty far, I'd say. So it's safe to say this landscape has been shaped by AI now. You mentioned trust before, that has to do with the experience, but trust matters even more now, more than ever before. It's going to be the word of the year, I think, or just the concept of the year, which is ironic in a lot of ways. But there are reasons why we are focusing so much on trust right now and asking good questions, I think. So, what's your take on the importance of trust, how that has to do with this AI shaped landscape that we're going in right now, and how that has to do with the experience of patients?
Yeah. I mean, I love this and kudos to us for making it this long without saying the word AI. We are. It's one of those things I think the more things change, the more they stay the same. And I don't say that to not say that AI is not revolutionizing the world in which we live and the work that we do. But it's just really changing and accelerating kind of strategies and how patients were looking for providers and healthcare organizations before. So you had pre-internet days, and you had internet, then you had search. All of these things became more and more sophisticated and became more digitally discoverable as a primary way. And so patients just have more tools to get the answers that they're looking for and to evaluate options. And so AI is just adding a new layer of depth of information that is available so quickly to them, really on demand. And so that's great for patients and consumers. Really raises the bar, for the clarity and the accuracy and the usefulness of healthcare content. So that's where that trust comes in. And so, a lot of the conversation I think in the world in which we live is about how are we found? How do we be sure that we're showing up in these AI results? Which feels like the new way of saying, uh, why are we not showing up on page one of Google search? So we're familiar with this story. I think the reframe of that question might be what makes a patient or a consumer confident enough to choose us and stay with us. And for the, marketing folks and comms folks that we kind of in our peer group specifically, we're back to things like your website content that is being scraped by AI and dispersed across all these various ways of searching is so important. And sometimes you just have hundreds or thousands of pages of old stuff that's sitting there. So again, we should have been doing this anyway, but just being really thoughtful about what are people looking to know? Is that information accurate and available? And doing that in such a way that that ensures that you're trusted and found.
Thank you so much for joining us today, for having this conversation with me. Viewers and listeners, if you want to learn more about Christine and the work she's doing, you can connect with her on LinkedIn. And if you want to learn more about Target Continuum and their unified patient acquisition framework, they're talking about these kinds of topics all the time about unifying different aspects of growth and marketing. You can visit targetcontinuum.com. You can connect with a team member there. So thanks for tuning in today. And again, Christine, thanks for joining us.
Enjoyed it. Thank you.